So, a little background on us, because I think this will help add some color to what we're talking about. We are a healthcare-focused cybersecurity company. We have healthcare clients of all sizes and types across the United States. And one of the things we also do, and Steve alluded to this briefly, is we are a full incident response company. So we've done hundreds of ransomware attacks, account takeovers, business email compromise, wire fraud, financial fraud, etc. So we have a really good understanding of how threat actors are breaking into networks. And through our forensics investigations and other things, we're able to take that knowledge and constantly tune and modify how we're addressing security risk for healthcare organizations. I think everyone's aware of how quickly this is moving from a threat perspective. If you look back even just a couple years ago, the quote unquote standard of care for vulnerability scanning was quarterly. Then we're like, well, quarterly is not really effective anymore because the threat actors are creating their toolkits, in a lot less time. And by the time you identify vulnerabilities over a 90-day period and remediate them, you may be at 4 or 5 months. So that's just not working. And then we started moving about 2 years ago to looking at the data on a monthly basis, and that was effective. But we now realize that's not even working anymore, right? So to Steve's point, we are looking at internal vulnerabilities every 4 hours, 6 times per day for your organization, prioritizing the risk. And another new feature, Steve, actually, we just released a couple days ago, is we are now flagging the known exploitable vulnerabilities within your organization. So those will get a special flag in EAGLEi telling you, hey, by the way, if you don't patch this, there's a high likelihood you could be, the victim of an event, right? So the KEVs often come from CISO. So we've taken all of this knowledge, all of this experience, and based on feedback from our medium and large clients, a couple years ago we developed EAGLEi, and think of EAGLEi as a risk management platform, right? Because we know from doing these ransomware attacks, the two primary methodologies that threat actors are utilizing to break into environments is people, right? So we say around 60% of cyber risk is from people, right? So we're talking social engineering attacks. The other 40% is typically through vulnerability exploitation. Vulnerability exploitation could be the initial entry point. Think of a misconfigured firewall, misconfigured device, piece of software in your environment that, like a browser, that has a known exploitable vulnerability. You visit a website, and exploitation happens there. So what we do is we basically use some attack surface mapping to try and say, hey, where do you really have risk? So the attack surfaces that we typically look at are your external facing environment. So think of firewalls or any internet facing device. Your internal attack surface, which are your endpoints, so servers, laptops, workstations, and devices like that. And then you have your people risk. We aren't taking into account any type of third-party risk at this point. That may be soon to come. But we all know that third-party risk is also kind of a big issue right now. It's trying to figure out how do we really map and calculate third-party risk, which is a whole nother discussion. So the concept here with EAGLEi is very simple. We can take all of this telemetry. So we have telemetry from internal vulnerability scans, port scanning, external vulnerability scans, cybersecurity awareness training, and we roll this into a cyber risk rating. And I'll say it's in near real time. Obviously, data is not coming in real time, especially like vulnerability data. We're just not pulling that in every minute. It's every 4 hours. External exposure, we're doing port scanning on your entire environment daily, right? Because we've seen so many ransomware attacks in the last couple months through firewall vulnerability exploitation, right? If you've enabled SSL VPNs or you haven't patched firewalls from vendors that are constantly dealing with vulnerabilities in their operating systems, there's a high likelihood you will get hit, right? And in almost all the ransomware attacks we've seen, in the last couple of months, it was some type of vulnerability exploitation on the firewall, right? Everyone keeps just saying, oh, it's always people, it's always people. That's just not our experience, and if you look at the data from the insurance carriers, et cetera, that's not really their data either. So we take all this telemetry, we wrap it into a cyber risk rating, as you can see at the center of the screen. In this case, this is all demo data, just so we're clear here. So sometimes the numbers don't align because they're scrambling and hiding confidential data, but the concepts are there. And if you look at the top left-hand corner, you're going to start with vulnerabilities. So we classify vulnerabilities using a scale of 1 to 5. 1 is low risk, 5 is critical urgent. So in the top left-hand corner, we're instantly flagging your high risk vulnerabilities. So those level 4 and level 5 vulnerabilities for your organization. And right now, we're looking at your organization globally. So if you have multiple offices or clinics or hospitals or facilities, right, you can look at your organization globally, but you can also quickly start drilling down to physical locations. So if you look at the window that I just popped up, you'll see that there's a purple swirl, and inside of that is a number, and that's the actual cyber risk rating for that specific facility. So one of the things we'll start looking at in a little bit more detail here is how do I, as a business leader, right, as someone who's in charge of cybersecurity, as maybe an executive of a hospital or a medical group, how do I quickly identify where I have risk so I can point the correct resources at it? Because a lot of times, in my experience, organizations are focusing their attention in the wrong areas and they're saying, hey, let's put all of our resources over here, right? And the threat actors look over here and that's where they attack you from, right? So, this whole concept of being able to understand my internal, my external attack surface, and my people attack surface, I think is extremely powerful because of all this telemetry. And more importantly, we provide KPIs, we provide historical data. So if you look right below the number 21 in the top left quadrant, you're going to see how your vulnerability management program is working over the trailing 12 months. So from a compliance and regulatory perspective, this is really important, right? I've done a ton of work with victims and law firms and Office for Civil Rights regarding these breaches in healthcare organizations. And one of the things that I have consistently seen with these OCR investigations is questions like, what were you doing prior to the event? And how were you managing security and risk? And did you have kind of the right things in place to address that? Or are you an organization that really wasn't tracking any of that? You had an event and now you're just going to say, okay, we'll be better after this. And as you can imagine, those are two very different paths from a investigator's perspective. If an investigator comes in and says, look, it appears you guys were doing a lot of really good things. You were managing risk, you were identifying risk, you were addressing it. That's a different conversation than an organization saying, like, we didn't know about this and we weren't really doing a good job. So from a compliance and regulatory perspective, and even executive level reporting, being able to track all of that type of data is very, very important. In the center of the screen is your cyber risk rating. It goes from low, medium to high, and that is based on a lot of the telemetry we are pulling in, and we're using proprietary formulas that are analyzing the data constantly and re-scoring you based on how well your team is doing from a vulnerability risk perspective, how well your training is being handled, right? Do you have a whole bunch of doctors and employees that just aren't doing their training? Or are you the type of organization that 99% of your employees have completed your training? All of that type of telemetry either positively or negatively impacts your cyber risk rating. In the top right, we are right now a SentinelOne shop. Full disclosure, we are actively looking at pulling in CrowdStrike data. So if any of you on the call are using CrowdStrike, let us know. We are well down the path with bringing that data in. So I would expect, probably Q4, we will have the ability to look at CrowdStrike data or SentinelOne data. Right now, those are the only two EDR tools that we're looking to integrate with. We're also pulling in the SentinelOne data directly. So instead of having to go into a console, you can look at your threats by your entire organization, by physical location. You can even break this stuff out by department if you're one location with lots of different departments. And then once again, the graph below the zeros there, that's just kind of showing you historical data over time. The chart in the middle, that long graph right here, that is a really nice KPI. So what we do is we give you the ability to benchmark your security posture against 2,000 other healthcare organizations that are under our umbrella. So a lot of leadership teams and boards, that are very focused on security have said to our clients like, "Hey, how are we doing?" Right? And prior to this KPI, a lot of leadership teams like, oh, we're doing great. We got all this technology in place, we're doing great. But where are the numbers behind that statement? So by being able to benchmark yourself against all of these other healthcare organizations gives you a really honest, I like to call it the gut check, in terms of how you're doing from a security posture. So we take the telemetry from all of these other healthcare orgs, map it against yours anonymously, obviously, and you can see, hey, am I above the fold, right? From a risk perspective, am I on average or am I actually doing really well? I'm below the fold. We're doing better than 2,000 other healthcare organizations. So from a leadership perspective, one of the things I always say is, you know what? You don't need to know anything about security. You can come here and just take a look at your risk posture and then say to the correct people like, hey, what's going on here? Why is our security risk increasing over the last 3 months? And the answer may be very simple. Oh, well, we just bought another facility. We're onboarding them, and their network is just horrific from a security perspective. Or it might be, well, you know what? The person that was doing all the patching, we let them go. Our network's not being patched anymore, right? That was a decision that was made. And then you realize, okay, we've definitely got a problem here, right? We're exposing our organization to very high risk. So being able to look at this data more from a numbers perspective than a technical perspective is extremely positive. Now, obviously, if you are technical, I believe we have quite a few technical folks on the call as well. You can start digging into this data, right? Looking at the risk associated with a firewall, a server, a laptop, a workstation, and understanding exactly what is wrong with that device from a security perspective, and most importantly, how is that device contributing positively or negatively to your cyber risk rating, right? So I'll show you a little bit about that in a couple minutes. Below the KPIs, we have some gauges. They're going to basically show you your external risk. Those are your left two gauges. What percentage of your firewalls have external vulnerabilities. So in this case, we're at 38%, which is usually not great, right? We usually like to see that close to zero. Then we have how many vulnerabilities in your external vulnerability gauge, then external exposure. So one of the things we identified about a year ago is your external environment, your perimeter, might not have vulnerabilities, but you could have services exposed that aren't considered a vulnerability. And a lot of times you just may not even realize that. We've seen numerous ransomware attacks where someone just made a mistake, right? A human opened a port on a firewall, someone allowed a license to expire on a firewall, the OS wasn't patched properly for whatever reason, and that created a tremendous exposure and often resulted in a ransomware attack, right? We know that hackers will scan, you know, tens of millions of IP addresses looking for these vulnerabilities. And if they find a vulnerability on your device, they will then sit there and pick away at it until they either can't get in or unfortunately do get in. So by having this constant analysis done on your external attack surface or perimeter is really critical. And then getting into the last gauge, the Black Talon Academy, that's our cloud-based training platform. That's your education, right? Your social engineering training. that everyone has to do from a HIPAA and risk perspective. So those are some of the gauges there. Getting down into a couple of the options. I'm not going to dig too deep into this, but asset inventory, right? Being HIPAA compliant requires you to have a good understanding of all of the devices on your network, right? Do they have our vulnerability agent installed? Are they running SentinelOne? What versions of these agents are currently running on the machines? And then one of the really nice things is from a risk mitigation perspective is obsolete operating systems, right? This is something that can create a tremendous amount of problems for you and risk if you're not aware. So we all know that obviously over time operating systems hit end of life. And what we found in most organizations is that they don't always have a great way of tracking this, or someone forgot about a machine sitting in a closet that was being used for inventory tracking and it's running Windows 7, right? Because they didn't have any visibility into it. So we give you filters here that basically allow you to say, hey, show me all my endpoints that have end of life Windows operating systems. And boom, you instantly get a list of these devices. And look, some of them you may have risk accepted already. Maybe you have a CT machine, an MRI, or some type of medical device, or EMR, EHR system that requires this operating system, and you're just not going to swap it out at this point. Okay, well, the first question is, do you know about it? And, what have you put in place to mitigate risk and accept the risk? So, little wins like this may not sound like a lot, but when we look at ransomware attacks and we look at, exploitation of environments, often these devices play a unfortunate critical role in further exploitation of data and the environment. We also have the ability to basically filter and search on anything you want within the platform. So if you have, a specific operating system you want to look for, a specific vulnerability, a piece of software, things like that, you can use the search functions, you can use the comprehensive filters to look at all of this data. We also allow you to drill down to a specific, location, site, or department, using this option right here. So you can use various search criteria to filter that information down. So if you're a larger organization and you don't want to look at thousands of endpoints, or you want to just say, hey, we just onboarded that facility 2 months ago, what does it look like from a risk perspective? You can just select the name of that facility and all of the data will recalculate based on that information. Another nice thing is we assign a exposure score to all of your endpoints. So you can actually just filter on the exposure score. So I sorted high exposure to low exposure. And the nice thing about this is we all know that your teams or managed service providers don't have unlimited time and resources. So Steve made a very powerful statement, earlier regarding the ability to prioritize risk and prioritize vulnerabilities. So we're once again using all of this telemetry and data to do the hard work for you. So if your team only has 2 hours today to address cyber risk, where do they even start, right? And that's the huge challenge especially in the vulnerability world, right? They generate these reports that are tens of thousands of pages of PDFs, or 150,000 line Excel sheet, and it's handed off to someone, and they're like, "Yeah, I don't. What do you honestly expect me to do with this, right?" And then typically they work on it a little bit and they move on to the next thing. So by sorting our exposure score column from high to low, I immediately know the endpoints that are really putting my organization at high risk. And now, as either a business leader for your organization, or someone that's in charge of cyber risk, you can direct the correct individuals and say, hey, that Athena endpoint and that 004E, server needs to be addressed. Can you guys please take care of that today? Right. And the ability to look at that data in a very quick manner is extremely effective. So that's basically our asset inventory. From a vulnerability perspective, this is also a very nice screen, and what it does is it allows you to understand either globally within your organization or down to the facility level, hey, what pieces of software are putting our organization at risk? What vulnerabilities, I should have said that a little different. What vulnerabilities within those pieces of software are putting us at risk? So once again, we can sort by score, we can sort by severity, the number of endpoints impacted or affected. And now I can say, wow, look at this end of life, Microsoft XML core services is causing, my security score to really increase. So is that something that, either Black Talon can patch automatically if you're using our patching software? The answer is yes. Or is that something my infrastructure teams, are going to be able to patch, or if you have dedicated cyber teams, they can patch too. But I can click on that EOL software, and it's going to tell me the severity of the vulnerability. So this is the highest level severity, what the impact, the threat, and the solution is. And your teams aren't going to have to try and figure out, hey, how do I get rid of this vulnerability? And they don't have to go out and search, their own knowledge bases to try and find it. In almost every instance, we're going to tell you exactly what's wrong and how to fix it. And then in the top right-hand corner, kind of the same concept that we talked about on the home screen, that dashboarding, like, hey, how are we doing over time from a vulnerability perspective? This is extremely powerful information because you can see how effective your risk mitigation is over time. This is strictly internal vulnerabilities. If I click on the tab for external, right, once again, we'll be able to take a look at, hey, what's going on with my perimeter, right? What is EAGLEi flagging as high risk? And if there are high risk vulnerabilities, then my team definitely needs to be addressing that very quickly. This will also tell you right here if there is a known if it is a known exploitable vulnerability, which typically means that threat actors have the ability to breach through that vulnerability, right? So for me, if I was in charge of network security, one of the things I'd be hyper focusing on is this screen and then drilling down and saying, hey, show me all the external vulnerabilities with known exploitable vulnerabilities because that's what's going to burn me down, right? A threat actor is definitely eventually going to come across your IP. And if they come across the IP and the correct tool set is running by the threat actor, they will find that known exploitable vulnerability and they will most likely get in. Unfortunately, that's just how it works. Take a look at all of the data out there over the last couple months on SSL VPNs, and this will kind of validate independently what I'm talking about. So in my mind, this new feature alone is worth its weight in gold. Yes, there are tools out there that can, do this for you. They have to be run manually, the data has to be parsed, things like that. But this is a fully autonomous platform. And one of the key advantages of what we're doing here is the ability for it to automatically map the external attack surface. So for most vulnerability scanners that organizations use, you have to load in the IP addresses, right? And if you miss one, that's part of your missed attack surface. So the way we do this and kind of the secret sauce behind it is very simple. The vulnerability agent that is going to be on every single one of your machines automatically reports back to EAGLEi its internet-facing IP address. So whether it's a hospital, a facility, a clinic, or Mary who does revenue cycle management working from home, we will capture autonomously all of those IP addresses. EAGLEi will then take those IP addresses, run vulnerability scans against those IPs, and will also run port scanning, right? So the ability to autonomously detect your IPs and then map your attack surface is really, really game changing because this goes back to the statement that I made earlier. A lot of attacks happen and result in undefended or unknown areas, kind of those black holes of networks. So this is a great way of minimizing risk. We had an amazing story just a couple months ago where a very large healthcare group with about 300 locations had a detection through EAGLEi where one of their network engineers spun up a virtual machine and accidentally exposed RDP to the outside world. And through this detection, they were able to instantly say, what the heck's going on here? Why do we have RDP exposed on this firewall? And because of that, they didn't get burned down. We all know, right, that if you turn on RDP and expose it to the world, the hackers will come in masses going after your RDP connections, right? So this is exactly what I'm talking about in terms of, hey, we need to map this stuff, especially the items that weren't previously identified. Threats, this is going to be, this is just blank right now, this is all demo data, but this is going to be data we ingest from SentinelOne, and then eventually CrowdStrike. All right, so that's going to be that. This is your port scanning data, right? So this is your daily analysis of services that are exposed through your firewall. Once again, we're giving those ports some type of security score based on the type of service, the amount of time it's been exposed, etc. So you would be able to dig into, any of this data here and instantly see, hey, what's the risk? Which firewall is it? What do I need to do to minimize that risk, right? We see a lot of organizations exposing the consoles for their firewalls to the world, and we know that often hackers will develop over time exploit kits that will help them bypass authentication through these exposed technologies. And then the last is our cybersecurity awareness training. So just to let you know, in order to have this score count, you do have to utilize our cyber training program. We have very specific healthcare cybersecurity awareness training versus what a lot of healthcare organizations utilize, which is just like generic business. So we speak medical, we speak dental, and when people watch this training, there's a connection there versus talking about, sending out a spreadsheet in a business environment, right? We're talking about, MRIs and CTs and EHR records and things like that. And we find that doctors and healthcare workers connect with that type of training versus, the other. So in a nutshell, this is the EAGLEi platform. And I would love to see if anyone has any questions, thoughts, and be happy to address them for you.